Hello, this is Howard Owens, publisher of the Batavian. We're doing another live stream interview this morning with John Bennett, executive director of GCASA, and we're going to talk a little bit about how the coronavirus stuff has affected GCASA and what advice or what services are available. So, John, good morning. How you doing?
Good morning, Howard. How are you?
Good. So I appreciate you taking time to talk with us this morning. You know, we're just trying to do everything we can to keep the community informed about the various aspects of how the coronavirus issues are affecting our community. And of course, JACASA is a big part of our community and provides a lot of services to a lot of people. So we just wanted to hear from you about, first of all, the impact of what all the new regulations and everything and directives are having on JACASA.
Sure, thanks. And Howard, thanks for keeping the community informed. These little vignettes are great. So we're open. First, I just want to say we're open, and we are, struggling a little bit like everybody else. But we've done some really creative things, I think, to protect our patients, our staff, and the community right now against COVID-19. First, let me talk a little bit about our OTP clinic. The methadone clinic right now, services about 150 patients, and we were very concerned about, having patients in the waiting room daily, and so we reached out to the Assistant Secretary of Health and Human Services in SAMHSA, and her staff got approval for us to do a alternative dosing site. So we actually set up a drive-through dosing in our parking lot using our big mobile unit, the big medical unit we have, and that has been a huge relief for everybody. So basically patients we use the parking lot as a queue. So basically the first car's in, kind of like an airport taxi area. The first car's in, they get out, get their dose, they get back in, and they leave. And so patients are able to get their medication. We do have a lot of patients on take-home, but, patients that just aren't ready for take-home are not able to do that. So this really actually is working out perfect. It's the first one in the nation to do this. Actually, Strong Hospital is setting up theirs this week. I called and talked to Patrick, and they are setting up their mobile unit, their alternative dosing site outside of their clinic this week. And I think others around the state and country are going to follow now. So it was a pretty, I will say that the government officials right now are doing whatever they can to help us with waivers and trying to make things safe. Our residential programs right now are somewhat quarantined. We do have a recovery center that opened a couple of weeks ago, and we've shut it down to the public, but our residents who live in our Atwater house are allowed to go back and forth between the recoveries. So they have a place to work out, get some so they're not cooped up. We are setting up the ability to try to take new patients because we recognize that there's still a need in the community right now for people who don't have another place to go and need a safe place. So we have a house that was called our respite house.
Can you hear me, John? I think we've lost John's signal. John, can you hear me?
I can hear you. Can you hear me?
Now I can. You said a respite house, and then from there everything cut off.
So anyways, just to back up a little bit, we have this respite facility that was a grant fund, and so can you hear me still?
Yep.
So it was grant funded. That grant dried up. So we have a 4-bedroom house that we're going to use to stage any new patients coming in. They'll have to stay there. They'll have to be quarantined there for like 7 to 10 days, and then they can move over to our community residence. So we're going to try to continue to accept new admissions. We obviously don't want them right off the street into our house because right now the folks in the house are protected because they have agreed to quarantine themselves, again, between there and the recovery center. But please, give a call if you need services. We're taking each case individually. We're certainly right now giving preference to Orleans and Genesee County residents. So give a call. Our outpatient clinics, we have, they're both still open. We're doing a lot of stuff right now, telemedicine and phone medicine, or whatever device that somebody can get on. We can use Facebook Messenger. We can use Google Hangout. So, if you need services, please call. We are still accepting intakes. We're doing a lot of those by phone, but some patients still need to come in and see their counselor. So we've set up, PPEs for them. We have masks for our staff. We have masks for patients. We're taking temperatures at the door. We're screening all the questions at the door. But we are still taking new patients. So please feel free to call. My staff right now is working one day from home. So they have computers. They're working from home one day, and every other day they're in the office. So we've cut down. Probably only a quarter of my staff are in the office on any given day right now. What else can I tell you? We haven't had any, positive cases over in our setting yet. We've certainly had a couple of people, too, through the distillery, oddly enough. And so I think that we are getting in a better place with being able to have protective gear for everybody who needs to use it.
How's the supply going? How's the supply going of PPE? Because we keep hearing about difficulties with that. You think you're going to be able to maintain the supply you need?
Well, we didn't have any to begin with. Oddly enough, I stopped down at the research and development, the R&D place down by our recovery center, down by Bones. They sell TVs and bikes and stuff. I went down there to get a TV for the recovery center, and on the middle of the floor was hospital-grade wipes, cases of them. So they gave me 5 cases, people in the 20 cases. So that was, snag. And then from there, my staff and I have been able to reach out to actually like Home Depot. They've been gracious. They've given us some. Sherwin-Williams has been able.
Broke up after
gotten some in some odd places. I broke up after
Sherwin-Williams.
Yeah. So, anyways, we've just been reaching out to some odd locations to keep our supply. I was able to get it off of eBay, but now we have orders in, and we hope that like in the next week or two, those orders. I actually am. If somebody has large quantity. Rob Kemp from Oasis has suggested that we might be able to be a regional reseller, and they're willing to, I think, give us some money to buy some larger quantities to get out to all the substance abuse providers, because we seem to be last on the list to get pretty much anything right now. So I am looking to fill like maybe an order of 500 or 1,000 masks and some other supplies that we could distribute regionally. So if anybody's out there, and you have any contacts, let me know.
It sounds like on the social distancing side of things and everything you're putting in place and protectiveness, you've pretty got bases covered, and you're still able to provide services. What this is a stressful time for people, and there's still people dealing with various issues. Kind of what advice do you have for people, either are currently say in a GCASA program, or just going through issues right now, and what advice would you give them to do?
Well, let me step back and address the stress part. Obviously, my staff have been amazing. They really have. They've stepped up. They're in the trenches. I feel like they've been very brave in managing this, and really not afraid. So that's been the good news. That they're just an amazing group of people. And my advice to all of them, we have a morning meeting every day at 9:00. We get on, and our motto right now is stay calm and don't panic, and we're doing whatever we can. But people out there right now who are struggling, I do worry about them, because this is also a time where obviously under stress, people use chemicals to, mask their emotional response to things. So really, I just want people to know, if you're out there and you need help, at least call us. We have a 24/7 hotline. We still have peers who are out in the community. Most of them are doing telehealth kind of stuff too. They're just like telecalls, but they'll call you, they'll talk with you, and we are open for services. So if you need us, just please call.
Has there been anything from your clients, feedback you've gotten about how they're dealing with this, or how it's affecting their lives, and kind of what are you picking up from the community, if anything?
I mean, obviously, everyone is nervous and stressed about this. I think some of our clients' anxiety is way up. I think they're, obviously concerned about the future. They're also, worried. Families are worried about their folks coming into contact, their family members coming into contact with anybody who's positive. Again, so I will say that before we moved our dispensing center to the outdoors, there was a lot of anxiety. I mean, I got calls from parents, I got emails from parents. And then since then, we've certainly had some people who have thanked us for doing that. And that I feel like the anxiety has gone down a little bit around that. But there is, Howard, there's just a ton of anxiety out there for everybody. I do remind people, though, that we do live in a low population density area. And I think out here in our regions have ramped up. And I think people are doing a good job in the community just to try to social distance and try to, use PPEs and try to maintain what we can to prevent the spread of this. And I think it's working in our communities, but time will tell.
I remain hopeful about where we're at. I also, frankly, we don't know how early we are in this and how much has already taken place that isn't being detected. I think that's why it's so important, everything you've described that you're doing. When your agency interfaces with so many people, to take the steps you take, I think is critically important for the whole community. So I thank you for that, I suppose. I congratulate you on that. Is there anything else you wanted to add?
No, just keep us informed, Howard. It's good to know that the local press is out there, keeping people informed, and because we're also right now entrenched in what we're doing, that it's sometimes hard to step back and remember that we got to keep the community informed too. And so I appreciate that. Appreciate what you're doing.
Well, I really appreciate your taking the time to do this. I know you got a lot on your plate, John, and so thank you very much. And we're gonna sign off now. We've got a couple more live interviews scheduled today. One of them, I believe, we're going to get to talk to Kathy Hochul, Lieutenant Governor, this afternoon. So I believe that'll be about 1:40 if you want to tune in. So, John, thank you very much, and you take care.
Yep, you too, Howard. Thanks.
Bye-bye.
Bye.